start that off now. And I would like to introduce Robin Price and Mark Skopek, who will be taking the session today. So if you'd like to take it away, guys, and introduce yourselves.
Thank you, Ollie. I'm Robin Price, the Bibliometrics Manager in the library at Imperial College London, which is a large research-intensive STEM-based institution in London. Thank you.
Thanks, Robin. And good morning, everybody. My name is Mark. I'm a research assistant in the Department of Primary Care and Public Health in also at Imperial College London. And yeah, we're really looking forward to presenting our project here today. It's been a long time coming, and we hope you find this interesting, and we look forward to your questions at the end of the session. I think, Robin, you want to start us off?
Yeah. So the project we're describing to you today is titled A Novel Data Solution to Analyze the Diversity of Reading Lists. This is a sort of research project that we have piloted on a master's course at Imperial under the so it falls under the question of looking at diversity and geographic representation in reading lists, which I know is I think a topic that is of interest to the conference here. So I wanted to start with Ollie, I'm having difficulty moving to the next slide.
Okay, just bear with me 1 second. I think you should still be co-host. Let me just try remaking you co-host again. Let's see if that helps. Okay, is that any better?
I don't think so, no.
Okay, do you want to try resharing your screen?
Okay, are you able to see the second slide?
Yep, it's gone to the QR code slide now.
Perfect. Okay, so we wanted to start off with getting your experiences with this topic of diversity in reading lists. So I have set up a Mentimeter quiz. So if you're either able to use the QR code or follow the digits that are on the slide. I will swap my screen over now. So I wanted to ask the room, has your institution made any effort to understand or improve geographic diversity in reading lists? Great, we have some responses coming in now. So we're asking on the range of, you haven't considered it, you've considered it but will not pursue it, you've considered it and might pursue it, you're in the process, we have finished and not sure. We'll give you just another 15 seconds for anyone else to respond to the poll if they haven't done so. But I think what's really telling is of the 44 responses, nobody's finished. This is quite long and difficult work that I don't think is, that we certainly have not in any way finished yet, and we as Imperial would be currently in the process. Okay, thank you all. And then you have a second question for you. So has your institution engaged in any of the below activities to understand geographic diversity in its reading lists? So we just wanted here to get a kind of understanding of what other institutions, if you are involved in this work or know of this work happening, are doing. So we have responses, yeah, not having work done on the topic, collect data about reading lists, e.g. author and publisher characteristics. Thank you. This is a lot of different types of activity going on and very interesting to see. Great. Okay, a few more are coming in. Thank you. And these responses will be interesting to reflect on later afterwards, and we can share these totals if they're of interest to you. Okay, thank you for that. I'm going to switch back now to some last few are coming in. Yep, so we can see that the largest response is tied between not sure and collect data about reading lists. So we'll be describing a method of collecting data that we've trialed here at Imperial. Okay. So over to Mark.
Yeah, right. So thank you all so much for sharing your reflections on that. That was really helpful to see. And I think we want to get started by kind of explaining our own kind of journey and way to how we got to working on this project. And so I did the Master's in Public Health program at Imperial College a couple of years ago. And one of the lecturers or one of the course coordinators introduced me to this idea of reverse innovation in healthcare. Just to briefly sum up what reverse innovation is, effectively, these are ideas or technologies or processes that originate in low-income countries and have first been used there before then being reintroduced in high-income countries. And because they're often frugal technologies or frugal ideas, they can be associated with large amounts of potential cost savings when they're introduced in high-income countries. Now you might notice there's sort of a prejudice almost baked into this term of reverse innovation. I mean, why is it reverse, and what does it even mean? But we're just going to leave that aside for now. We'll get back to that later in a second. So here are a couple of examples of reverse innovations. We have the Arbutus medical drill cover system, which is basically a reusable, sterilizable pouch that can convert a regular hardware drill that you would use to put up shelves in your home into a surgical grade drill. This was first used in Malawi in a low-income setting and is now being trialed and used in a trauma hospital in Baltimore, Maryland in the US. Then we have the GE Mac 400, which is a portable echocardiogram or EKG machine that was first used by physicians or doctors in rural India and is now also being used by a number of physicians in rural areas in the US and Canada and other high-income countries. And then finally, we have the Brazilian Family Health Strategy, which is a community health worker-based healthcare system that in its first roughly 15 years of action was scaled to cover nearly 70% of the Brazilian population and is associated with large improvements in the management of a number of chronic health conditions, and now is being pursued with great interest by Westminster Council right here in London. So you might think that because these ideas, they have a lot of potential and there's potential for cost saving, they might be met with great enthusiasm when they're introduced in high-income countries. But the fact of the matter is that's not the case. So for the Arbutus medical drill cover system, it's taken the better part of 20 years to actually get a high-income country to use this. And for the Brazilian Family Health Strategy, when NHS workers were first introduced to this idea, a lot of the reactions were something like, well, what can we possibly learn from a country like Brazil? Or does Brazil even have a healthcare system? So as I said, and I'm going back to this term of reverse innovation, it's a very pejorative term because in a way it suggests that learning something from a low-income country is backward or reverse. And so this really was sort of the impetus for us to think about, if this applies to these kind of technologies and products, might this apply to research as well? Next slide, please. And so in a way, we were able to quantify this bias. So this study by Matthew Harris, done in 2017, was done among a group of English clinicians. And effectively what they did was, they gave these clinicians 4 abstracts to review on 2 separate occasions, 1 month apart. And they found that when these abstracts were fictionally attributed to a university in a high-income country, the clinicians rated them as stronger, more relevant, and were more likely to recommend them to a colleague if they were attributed to a university in a high-income country as opposed to a university in a low-income country. So once again, these are the exact same abstracts rated by the same people 2 months apart. The only thing that changed was where the research came from. And again, we see that there's a bias against research that comes from a low-income country, because these physicians or these clinicians rated the research as stronger and more relevant, and were more likely to recommend them to colleagues based solely on the fact that they came from a high-income country. So again, this made us think about, if this is how we consume research, do we, as the people making the reading list for our master's students, what kind of role do we play in this process? And are we acting on these types of biases when we choose what we're teaching our students? Next slide, please, Robin. So here, you might be familiar with this map already, but this is effectively a map of a bibliometric analysis of citation counts. So basically, it just shows, how global research is consumed and where it is consumed. And effectively, what it shows again is, a disproportionate amount of research is being, or citations come from high-income countries such as the US and the UK and Western Europe. Now, we can't say specifically whether or not this disproportionate distribution is due to the bias I just described earlier. What we can say is that this is an echo chamber, right? And that this probably isn't representative of the global research landscape that's out there. And we began to wonder then, for our Masters in Public Health course, which has a global health stream, and we like to think that we teach a global curriculum, are the materials that we use for our teaching reflective of this sort of echo chamber, or this sort of map? And so the question became not necessarily what we teach, but from where we teach. So next slide, please, Robin. And so the project began, by looking at a reading list and wondering, how can we convert this type of information, just a list of citations, into information that is easily digestible, easily understandable, and above all usable for the people who are in charge of making the reading lists, as a way to kind of start this conversation off about, again, not what we teach, but from where we teach. And so I'm going to pass over to Robin now, and she'll give you a bit more information on how we actually came to achieve this.
Thank you, Mark. So these questions about a reading list. So this is what we started with. Does geographic bias exist in specifically this Masters of Public Health reading list? We set out to try and answer that question specifically in a manner that was looking for data to make an evidence-based decision. And then thirdly, we wondered, would this method be, could we make a method replicable to study this potentially for other courses or for the same course over different time periods? And to just give a insight into the kind of the amount of data that we were working with on this course. So the masters, we were looking at 16 modules that represent around 700 references on reading lists. So this is difficult questions that we were asking of quite a large data set. So the way that we tackled this question, so we started with, we have here an example of a journal citation that is from the Masters of Public Health reading list. So we developed a method where the computer is programmed to retrieve the citation from the reading list, to retrieve every citation from a reading list. It then takes the citation through the Web of Science, through the Web of Science API, where it then picks up the author countries that the Web of Science has associated in the authors with in their referencing system. So you can see in this example, there are 4 authors from this one citation. And so the Web of Science has brought us 3 countries representing the 4 authors: UK, USA twice, and Singapore. This is one example of a citation, and it would repeat this for every citation on the reading list. We then take the citation and these country data through the World Bank's GNI per capita ranking. That's also an API. And the GNI per capita is a ranking of every country recognized by the World Bank for this kind of analysis. And we're using a reverse percentile ranking. So the country's position, the numerical position in the ranking, is then added. Taking these 3 countries, 3 positions, and 4 author representations, we've calculated what we've called for the time being a citation source index, which is a sort of weighted average of the number of authors, their countries, and the World Bank ranking, which then is derived a 4 decimal place figure. The figure then can be used to get some kind of quantitative insight into the overall balance of the countries and the GNI's per capita ranking involved for each citation. And so the way to understand this figure would be that a figure here on the bottom right, so that in this example is 0.9323, that if the closer this figure is to 0, the more primarily lower income countries, as per the Web of Science and the World Bank's ranking, are derived in the citation, and closer to 1 would be higher income countries. So the proof of concept that we derived through ICT, Leganto is the reading list management system that we use. We wrote SQL text that retrieves data for each item with a DOI, it exports it. We have a PHP script, calls the Web of Science API. It then calls the World Bank API. And then we in Excel did the citation source index calculations. So we were able to perform this for items from the Martyrs of Global Public Health reading list. And we have here the results. So what you see over these box and whisker plots are on the y-axis, that citation source index that we described was the metric that we calculated, remembering that any score closer to 1 represents primarily higher income countries, and closer to 0 is primarily lower income countries. We performed this for 2 time periods of the same course. So where you see these, the couples of the box plots in color coding and the de-identified course names, so 2017 to 18 and 2019 to 20, those are the 2 different time periods. So then you're able to compare the 2 time periods of the same course, and then also compare each module against one another. So then each data point on the chart represents a reference of the reading list. So what we have in development is a Power BI, which is a business intelligence tool used by the college, a database which is going to, we hope, be able to pilot to other courses who might be interested in seeing that kind of analysis. We'll show them that data and visualizations, and we're working with our education leadership in the institution and with faculties to build this tool. And then we are also working on a web-based browser tool, which will have the same data structures and calculation methods that would mean that you could run this analysis technically for any CSV file of reading list items. So Mark.
Right, so as you probably have picked up, there are a number of issues, or kind of conceptual as well as technical issues that we still have to resolve. And so one of the big questions that we have is this really due to racism? Is this due to bias? What is the real explanation for this type of skew that we have? Because as our analysis is quite descriptive, we only looked at the very surface level descriptors of a paper. we don't really know whether or not, this is due to bias or if there's some kind of more benign explanation for the skew that we see. Next point, please, Robin. Another valid question to ask is whether or not an institution like Imperial College can really dismantle colonialism. And kind of going off of that is, we realize that we're also using information from, for instance, the World Bank, or we're relying on the Web of Science or Power BI, where there might be biases sort of baked into the actual data that we're using. And so, it's a big question to ask is, what role does that play in the kind of the output that we have here? Another limitation is that we're using the country affiliation or the institutional affiliation of an author as a proxy for country affiliation. But of course, we know nothing about the actual author involved in that paper. We don't know anything about, or in most cases, we don't know anything about, who they are or kind of what their academic trajectory has been. So really, it's just a very surface level descriptive analysis, and we're making huge assumptions about these authors by just taking the institution affiliation and using that as a proxy for country. Another good question is, what does this look like when we actually, take this to a lecturer and say, this is what we found from reading list, and we want you to do something about it. Does it help to actually just, put more geographically diverse research onto a reading list? I would argue probably not. There needs to be some sort of intentionality behind it, and just putting on more low-income country research for the sake of doing it without actually, including it in the teaching or kind of giving students a way to reflect on it doesn't really solve any issues. It just kind of might, again, be perpetuating a problem around tokenism. Next point. This is another very important question to ask, and I think this kind of also goes back to the poll we did earlier in terms of, has anybody finished this? I mean, do you ever really finish a process like this or a project like this? How do you measure success? Is success having a diverse reading list? And the question is, when is a reading list diverse or diverse enough? Or when is a reading list decolonized enough? So these are all questions that we kind of have to grapple with. And for the time being, I think we're calling it a success for the fact that, first of all, we're able to present something to you here, but also that we're starting these conversations at our institution and getting people to think about these issues more. Whether or not they can act on it is a different question. But again, I think it's important to to decide for oneself, how is success going to be measured in this situation. Next point. And this, I guess, going back to a previous point is, around the tokenism, how do we actually ensure that people are intentional with this tool, and also who will be using it? Is this meant for, like I said, the lecturers or the people who are the teaching fellows who make the reading list, or is this tool meant for students, or is this tool meant for potentially subject librarians who might, run a reading list through this tool and then come back to the lecturers and say, hey, look, we found that your reading list has a very high skew towards such and such. Is there a way that we can have a conversation about perhaps, revising it? So that's another important question that we are asking ourselves. And then finally, we have this, what we're calling epistemic fragility, which is something that a term that we borrowed from Robin DiAngelo's white fragility, which you might be familiar with. But as Robin said at the start of the lecture, Imperial College is a very STEM-focused institution. And epistemic fragility is sort of what we're calling types of reactions that we observe when two epistemologies clash. In this case, we have the STEM epistemology or the STEM worldview, which prides itself on objectivity and being free of bias and being merit-based. But then our project specifically, as well as kind of the colonial movement as a whole, really challenges that by saying, is science really objective? And we would argue, obviously, based on our findings, that there is bias baked into science, which likes to think of itself as merit-based, as you can see from these quotes. So when we challenge kind of these pillars of the scientific or STEM epistemology, we must kind of expect to see these types of fragility reactions or defensive reactions associated with it. So yeah, these are the basic conceptual issues that we deal with. And Robin's going to go into some of the technological issues now associated with the tool itself.
So the technical limitations of these are also things that we have encountered and are trying to correct. So at the moment, the method can only calculate the CSI for journal articles, and with that being actually journal articles that have DOIs. And we know that even, you know, for STEM courses, that is not sufficient. We would want to be able to capture this data for all different types of outputs that are on reading lists. At the moment, this method also has to use Leganto, which is our reading list management system. So see, that's a lot of, you know, lecturers maybe are not solely using Leganto as their method of disseminating suggested reading to students. So we are trying to develop a way to capture reading list outputs that are not on Leganto. And also the Web of Science, you know, is a selective, exclusive, biased database, and that is a difficulty. And we really would like to be able to use a bibliographic database that either is more fuller in coverage, so potentially Scopus we will be exploring. Even then, you know, so Scopus does have coverage English language bias as well. And just to really quickly give you an idea of the amount of data that was viable for our study. So we started off with 1 year of the reading list with 660 citations. And of that, we lost 46% of them for not having a DOI, then a further 10% because the articles were not indexed by the Web of Science, and then 0.9% because the authors weren't recognized properly within the data wasn't clean from Web of Science. A huge number of people have been involved with this at Imperial. We have further reading in our slides for anyone interested. And thank you. We've come up almost to the end of our session, but we would love to have your questions over the text. We'll try and answer them, or in the water cooler sessions. Thank you.
Thank you very much, Robin and Mark. That was a fantastic talk. I don't know if we've just got time for one question. We've got a couple of minutes left. If you'd be happy to try and, okay, I'm just going to go through them in the order that they came in the chat. So the first question from Ingrid Francis. How can NHS embedded health librarians contribute to this work when reading lists are often compiled by academic institutions and inform our own collections, as it is what the medics are told to read? Is there a way medical librarians and academic librarians can work more closely?
Oh, that's a great question. So we have, so Imperial is a large NHS trust, and we do have NHS librarians who, I have to say, actually, I don't know enough about the role of NHS librarians, but wherever you are involved with reading lists, if we are able to develop our tool to be able to sit in a browser that would be publicly accessible, which is what we're trying to do, then technically anybody who, you know, has a CSV file of reading lists with identifiers in, you would be able to put that data through the browser to see this data.
That's great. Thank you both. Well, I think we're out of time, I'm afraid, for this session. But again, I would just really like to thank Robin and Mark. I know it's a little bit difficult on Zoom, but I'm sure we're all giving them a virtual round of applause for that fantastic presentation. So yeah, thank you all very much for joining us, and do enjoy the rest of the conference today and tomorrow. So thank you again very much for Robin and Mark, and I'm sure they'll be happy to carry on taking questions at the water cooler session as well.
Thank you.
Yeah.
Thank you all.
Thank you very much, guys.
We'll be there, and also feel free to email us with any questions. Our emails are on the slide there. But see you soon.
Great. Thank you, guys.